Good afternoon, everyone. We are right on time and we have a lot of information to go over, so we're going to go ahead and get started. My name is Nancy Patton. I work in marketing and communications here at Saltmarsh, and we appreciate you guys joining us for today's webinar on the CARES Act grants and provider relief funds and reporting obligations. Our webinar is presented by our healthcare leadership team of Andrew Kent, Claudia Rangruber, and Al Grimes. But before we get started, we have some housekeeping items to go over. Everyone is muted, and if you're not muted, please go ahead and do so. If you have any questions, feel free to share them in the chat, and at the end of the presentation, if we have time, we'll go over those questions with everyone. Our team's contact information is also at the end of our presentation, so if you have any questions or need some additional guidance, go ahead and contact one of them or anyone from our healthcare team. Our presentation is also being recorded today, and so you'll receive a link to view that on demand along with a copy of our slide deck in a follow-up email tomorrow. And if you've enjoyed our webinars so far, or if this is your first one, we want to get your feedback, and we want you to take a moment to finish our survey that will be also in the follow-up email tomorrow. But that's all the housekeeping items we have, so I'm going to turn it over to Andrew Kent, shareholder and leader of our healthcare consulting practice, to get us started.
Excellent. Well, Nancy, thank you very much, and welcome again to our clients and friends out there on the internet today. Got a lot of information to cover. We're going to try to move and stay on time and end on time as well. We know everybody's busy these days. So yes, this is CARES Act Provider Relief Funds Part 4. Today we're going to be focusing on reporting obligations and updates to the latest frequently asked questions. The agenda is, like I said, we're going to do a very brief overview of the COVID-19 CARES Act Provider Relief Funds to date. Then we're going to talk about the funds that are currently open and available to providers. And then probably the largest part of the conversation today is going to be spent on the reporting requirements. We have new guidance as of September 19th. We know lots of providers are really interested in what the impact is going to be for them. And then we're going to go over some frequently asked questions and also some questions we've gotten from our audience today. So with that, I am going to turn it over to Al Grimes, and Al will give us a brief discussion of the historical aspects of the program. Thanks, Al.
Thanks, Andrew. Good day, everyone. Those of you that have attended the first three or any of the three previous webinars, the first couple of slides are just will look familiar to you as far as an overview of the COVID relief programs that are currently out there and available. We wanted to note that on the Medicare Accelerated Advance Payment Program, or the AAP, those were the funds that were issued to Medicare providers, and according to Kaiser, 92% of that money went to Part A providers, with the balance going to the other parts. And $100 billion was issued basically within a month time frame. And they suspended it in April, once all the other CARES Act provider relief funding programs started to come out. Well, there's been a change in the AAP effective October 1st, as a matter of fact, passed with the temporary funding bill that the government put out under Title V, Section 2501. Section basically delays for 12 months and full repayment for 29 months. It also caps recoupment to 25% of the amount that they gave you over the first 11 months, and then 50% for the next 6 months, with the interest rate being reduced from a potential 10% to being capped at 4%. The suspension of Medicare 2% sequestration is still in effect through the end of the year, through December 31st. And then hopefully you've attended some of our PPP loan application webinars. There was a Wall Street Journal article actually this Tuesday that noted that the SBA has been instructed to start forgiving loans to owners, as there were several complaints, been multiple complaints, that since August, there's been 96,000 loan forgiveness applications submitted and 0 had been approved. So they've guaranteed that they're going to start moving on that almost, well, as we speak. And then the CARES Act provider relief funds, the general and targeted distributions, they'll be covered in subsequent slides. Andrew, Claudia, have I missed anything on this?
No, I just on the PPP forgiveness applications really quickly, you know, that even those 96,000 forgiveness applications, that sounds like a lot, but that's still just really a very small piece of the overall PPP pie. And I think the big takeaway there, Al, was the changes to the Medicare advance payment recoupment, the extension of those deadlines and the extension of the recoupment period. So no, you want to go on about the provider relief funds a little more?
Just a little bit more. Originally, the CARES Act basically granted HHS 175 billion in funds to be distributed. To date, there remains about 18% that hasn't been allocated to either general or targeted distributions. The chief change from our last webinar is that at that time, it looked like that they were through with general distributions and they pretty much maxed out at 65 billion, with the balance to be remained for targeted distributions to specific affected providers. They've since, and we will be covering this in later slides, come out with a phase 3 general distribution of $20 billion. So 85 billion in general distributions have been allocated. The next slide is basically the graphic representation, and we've updated it since part 3 as the phase 3 of the general distribution was announced. Providers that have already received PRF or provider relief fund payments are invited to apply for this 20 billion under phase 3. And considering your financial losses and changes in operating expenses caused by the coronavirus, and we in detail. Previously ineligible providers, such as those that began business in 2020 and didn't have 2019 financial data for the program to be based off of, will be invited to apply. And they're also expanding the group of behavioral health providers. Once it was a smaller selected group, now they're expanding that to be available to apply for these relief fund payments during this application window, which is from October 5th to November 6th of 2020. And with that, unless you want to add anything, Andrew or Claudia, I'd like to turn over the next slide to Claudia Rangrick.
All right, Claudia.
All right, thank you, Al. So we're going to continue talking about the phase 3 general distribution fund, and that was just recently announced. And what this is going to, or how this calculation is going, the funds are going to work, is that so far, as Al said, 122.9 billion have been released out of the 175. So this will take another 20 billion out of that bucket. And one of the providers that will now be eligible that Al mentioned, I think is very important, and that is the behavioral health providers. If behavioral health providers in the earlier general distributions in the second phase 2, if they billed the Medicaid program or the Medicare program, they were eligible to apply. But there are a number of private behavioral health providers that do not bill Medicare or Medicaid who were ineligible to receive any of those general distributions. And that's important because there's been a lot of data that has been published showing that there's been an increasing frequency of providers that are behavioral health concerns, I guess, in the country as a whole. So, so that expanded eligibility was important. Now, this portal closes on November 6th. It opened on October 5th, 3 days ago. So you have until November 6th to make application. And the way the funds will be, and that isn't very long. So you want to, it's only a month, and it's important to do this as soon as possible in order to enable HHS to do the calculations that they need to do. The way the payments will be calculated, or the new distribution will be calculated, is they're going to make sure, first of all, that every applicant has already received 2% of net patient revenues. So if you are, for some reason, have not yet received that amount of funding, then that will be the first check that HHS will make. And then beyond that, there's an additional potential for an add-on based on new information that you can submit. And so it's important to go through the application process and determine what kind of information you need to submit, but just briefly, you'll be looking at changes in operating revenues and operating expenses based on the previous data that you've reported. As I said, HHS says to apply early because they will not be able to issue any of these additional phase 3 distributions until they've analyzed everyone who submits an application. So that will happen after November 6th. And then they have to go through the calculations that I described in order to determine how much funding is available and how they're going to distribute it. There's specific terms and conditions that as have been the case with other distributions. And it's important to note that there's going to be a phase 3 webinar that HHS is going to hold on October 15th. So about a week from now at 3 p.m. Eastern Daylight Time. And so you'll want to, that'll provide additional information about the application process and how the funds will be distributed and et cetera. And there's a link to the website where you can obtain a lot of information. They have slides that are available to kind of show you what the phase 3 involves. They'll give you a checklist of all information you need to gather in order to submit. Once you submit that application too, it's very important to know that you cannot go back and correct anything or edit it or resubmit an application if you've made an error. So that's why they stress how important it is to assemble everything in advance. Just to kind of illustrate that point, the application itself is only 2 pages, but the instructions to the application are 12 pages. So there's quite a bit of information there, and they've tried to make it as easy as possible, and you've got the link right there that will enable you to access all of that information.
Cardi, the big takeaway here is that we don't really know yet, unlike some of the prior distributions where we've been provided with a formula or specific instructions on how the provider payments are going to be calculated. Here, it's what HHS is asking is for everybody to submit information. There's going to be a true up for anybody that hasn't yet gotten to 2%, and then based on who applies and how many people apply and what the information that HHS gets, they're going to then divvy up this remaining 20 billion, right?
Right. And I think another important point is to just encourage everyone to apply. We still are in the midst of this COVID pandemic. We're not really quite sure what's going to happen in the future, so it would probably be important for everyone to check and see where they would fall and if they can apply, and to assemble that information and go ahead and do that. So then we also have available, there's the COVID-19 uninsured program, and there so far about 1 billion has been distributed to over 125,000 different providers out of these uninsured funds. So that was as of September 10th. The total available is 2 billion. So we've already spent or have the government's distributed about half of the money that's available. There may be some additional funds available through other CARES Act relief funds. So 2 billion was from the FFCRA relief fund. The administrator of these uninsured program distributions is United Health Groups, and they're doing under contract with HHS. And it's important that if you are treating someone who is uninsured, that means that you have verified as best as you possibly can that they have no other source of insurance available of any kind. And if you are treating someone, then the government is going to has this program available so that you can receive funding at Medicare reimbursement rates for treating, testing and treating anyone who is completely uninsured. Having said that, though, you want to make sure that you evaluate that carefully, that you verify, and then you have to attest that the patient has other payer available based on the efforts that your best efforts in order to identify that. And that it's important that COVID-19 has to be the primary reason why you're treating them. And what kinds of things are covered? It's everything from the specimen collection and the diagnostic tests and antibody testing, the visits that are made in order to, with a patient, and that can be in an office or urgent care center, emergency room, hospital, SNF, LTAC, IRF, home health agency, basically in any location. And the treatment can be a number of things. It can be ambulance transportation, whether it's urgent or non-urgent, the drugs that are associated with treatment, and vaccines when available. And payments will usually be processed within 30 days. And once you submit the bill, you cannot correct it. So it's very important to make sure that you have the correct information when you submit the claim. And there's a website there that you can also obtain additional information. And I think Andrew wants me to move along because slide. Just a little hint there, I guess. So another fund that is available is this $2 billion incentive payment plan for nursing homes. And I think this is probably one of the more confusing pieces of guidance that have been published. So we'll just go through the criteria just generally. Number one, there's no need for you to apply. These payments are automatic for SNFs who are eligible. And in order to be eligible, a nursing home has to have a COVID infection rate that is less than the rate in the county in which they're located. And they also have to have a death rate from COVID that is less than the nationally established threshold. And there's no additional reporting that you'll have to do in order to obtain any payments you may be eligible for under these additional funds. Because the government is going to use the data that you're already reporting, and you probably feel like you spend half your life reporting, and so you won't have to do anything in addition in order to obtain this. There will be 5 periods, and up to 400 million will be, and these have already begun. The monthly period, the first monthly period was September, and then they will continue in October, November, and December. And then the 5th measurement period will be an aggregated analysis of all 4 of those months. And as I said, up to 400 million for each will be distributed. And these payments have to be used for infection control expenses. And there is more information available on this website that is shown on the bottom of the slide.
Excellent. And Claudia, I was not trying to rush you along. I apologize. I answered a little early, but we're doing great on time. We're about a third of the way through.
I wasn't sure there, you know.
Yeah, so we're good. So the next slide is on some more information on the current open funds. Claudia?
Okay. There are also additional programs available, and this includes the AHRQ National COVID Action Network. These are potentially funds that you can qualify for, and up to $6,000 per nursing home. I think I may be one ahead of you. Am I one ahead of you, Andrew? I'm sorry. No, right there. Okay, the yeah.
Yeah, I think we're on the
Okay.
AHRQ. Mm-hmm.
Okay. So what this is free training and mentorship. There's been such a focus on making sure that nursing homes are given the tools and the information that they can use in order to improve infection control with this very difficult disease. So this is free training and mentorship that will be provided. It's a 16-week training session. Someone has made a comment they can't see the slides. I don't know. Maybe Nancy can check into that. But the 16-week virtual training session, and these are small groups of providers that are going to be following a standardized curriculum and working with academic medical centers and other large healthcare systems. And for SNFs that actively participate, they are going to be eligible to receive $6,000 in compensation to cover the cost of staff training time. And in order to get more information about this, it's there have been a lot of resources that have been dedicated to bringing this program to nursing homes. There's an introductory webinars, a series of them that are going to be offered in October of 2020. And you can obtain more information at the AHRQ website that is listed on the bottom of the slide.
Excellent. Ready for the next slide, Claudia?
Yes. So there's also a national COVID training program for SNFs, and this is referenced as the title, the exact title, which is may help you find it, is CMS targeted COVID-19 training for frontline nursing home staff and management. And the whole intent of this is to strengthen nursing home infection control practices. And we talked a little bit about this in the last seminar, but there will be 5 modules for frontline nursing home staff. And those include things like hand hygiene and the use of PPE and screening and surveillance, cleaning, cohorting, how to deal with patients who have dementia during the pandemic. And then there are 10 modules for nursing home management, and these encompass some of the very same topics, but also go into other areas such as emergency preparedness and surge capacity, deal with the emotional issues that many caregivers and nursing home workers and the residents in the facilities are having to deal with. Also encouraging the use of telehealth, which has become a very important aid that nursing homes can take advantage of, and also letting management prepare for the vaccine, its eventual delivery next year.
So, Claudia, we have a couple questions. Some of the items you've covered. The first is the 2% net patient revenue, and this is going back a couple slides for the phase 3 true up. The question is, what period is that 2% based on? And I believe it's based on either 2018 or 2019, depending on the information you provided to HHS. Is that still correct?
I think so, yes.
Yep. And then also, then there's a question about, is there funding contingent on participating in the CMS training? And is that the $6,000 that? Okay,
this is, if you ask me, I think this is one of the most confusing areas out of all of the information that has been published. This is to the best of my ability, researching all of these websites. There is funding available for the $6,000 if you participate in these smaller virtual group meetings with academic medical centers and they're very geographically established. And that was the program that we talked about just a couple of slides ago, where you're eligible to receive $6,000 for enabling your staff to participate in these training sessions. This particular training session that I just spoke about, the National COVID-19 Training Program for SNFs, this does not, in what I could find, have any information available regarding funding. What they have said previously was that you will get a certificate, and that these certificates can be posted in the nursing home and will help demonstrate your commitment to infection prevention and control during this pandemic. But as of right now, based on what I've been able to determine, I do not see any evidence of where there's funding associated with this. Of course, there's a lot of information out there that has recently been published. There are new frequently asked questions that change practically daily. So if we identify any additional revenue sources that may be associated with this training program, then we will let you know.
So if I could just ask to summarize, there's been no mention of a rate a potential rate add-on like we had a couple of slides ago, and there's no funding contingent upon a facility or a provider completing this particular series of trainings.
Not that I have been able to find, that's right, Al. So I think what you will get are these certificates of completion that you can post and evidence, the extra steps that you're taking to be able to identify the, to show how much how hard you're working at infection prevention and control.
Excellent. All right. And I would just remind everybody too that the guidance on these items changes almost daily.
Hourly.
Yeah, so it is a lot to keep up with. All right, Claudia, you want to jump in now to the kind of the second half of our discussion today, which is on the recently published reporting requirements, something I know our audience here is interested in.
This is probably what all of you are I imagine, very interested. And I know we expected that we would get some frequently asked questions and some other materials that might be published to help clarify these reporting requirements. But so far, as of the last check, of course, it could have changed since we checked this morning. But as of as recently as we could check, there hadn't been any new frequently asked questions. And I'm sure there will be a lot of frequently asked questions. Certainly, we have identified some. So this is something you're going to want to monitor. But the guidelines were originally promised much earlier, back in August, and they got deferred. And they were finally published in about a 6-page document on September 19th, 2020. And the amount of reporting that you'll be obligated to do depends on how much you have received in provider relief funds. And we'll go into that in a little bit more detail. And the reporting also prescribes more specific guidelines as to how you are to use the provider relief funds. And I believe some of you are going to look at this and say, that's not what they said before. This sounds different. But this is the way that the reporting guidelines have been defined. So you will be using, or they will want you to report how you've used the funds for COVID expenses that have not otherwise been reimbursed. And we'll have another slide that goes into that in more detail. And also lost revenues can be, is what some of the PRF funds can be used for. But lost revenues is now defined as a change in net patient care operating income from 2019 to 2020. So basically, we're going to explore that in a little bit more, explore that definition in a little bit more detail, but that's clearly a change from previous guidance. The copy of the notice, the 6-page notice, there's a link that we provided to you, and also there's a summary document that has the reporting, some important dates on it that are not contained in the more lengthy instructions or requirements. I see people are asking lots of questions. Probably what we'll have to do is cover some of these when we get to the end, or in a separate. We'll follow up certainly if we're not able to get to all of these.
We do have a couple questions here that we will get to, so we'll address those. If anything we don't address, we'll try to get to at the end. But a couple of the questions are being asked right now. We will get to in a couple slides here. So, all right, Claudia, you want to?
Okay, so based on the amount of the provider relief funds that you received, that's going to determine what kind of reporting obligation you have. So one important step is which of these funds that have been distributed you have to consider when you total up and aggregate all of the provider relief funds. Number one, all of the general distributions would have to be included, and the targeted distributions have to be included. The ones that are listed here, the high impact distribution, which went to hospitals, rural distribution, which excludes the rural health center testing distribution, and the SNF distributions, except that also excludes the infection control distribution. Then you have Indian Health Service distribution and safety net hospital distribution. So you've got to total up all the amounts that you've received from the above.
Excellent.
And then moving on to the next slide. The levels of reporting then are defined by the amount of funds that you received. So if you are one of the lucky and probably very few recipients who receive less than $10,000, then you don't have to do any reporting. You do have to, however, continue to document how you've used the funds, but you will not be required to report those. The next level is if you receive $10,000 or anywhere in between that up to $499,000, just less than $500,000. $10,000 to less than $500,000, then you will be reporting COVID-related expenses not otherwise reimbursed. And they've made it very clear that this includes general and administrative expenses, overhead support costs, etc., operating costs. And then lost revenues. And again, lost revenue is represented or going to be calculated based on the negative change in net income from 2019 to 2020. And then you will also be required to provide other specific financial and non-financial data. And we're going to go into that a little bit later in some additional slides. Now, if you receive $500,000 or more, then you report all of the above categories, but you're going to be reporting much more detail. And we have slides that explain what that additional detail is. Now, as we said, there will be frequently asked questions. None, at least the last time we checked, none have been published yet. In addition, HHS is going to have webinars to explain this, to answer questions, to provide examples and case studies, etc., to be included.
Excellent. All right. All right, key dates, Claudia.
All right, key dates. The first important date, this is later than what we initially anticipated or we were told. The portal will not even be open until January 15th of 2021. So, you know, we've got months here before we're going to be able to even begin reporting this information. The next critical date is February 15th of 2021, which is the first reporting deadline. And that will cover all of the, how the funds, the provider relief funds that you received, how you used them up through December 31st of 2020. If you have not used up all your provider relief funds by that point, then the next important deadline for you will be July 31st of 2021, which will be what HHS is calling the final reporting deadline. In other words, it's their expectation that in that reporting period, which is from January through June of 2021, that you will have expended all of the funds that you received, the provider relief funds. So that's the final reporting deadline. And one other important auditing aspect of this is that the single audit requirements will apply to any recipients that have expended $750,000 or more in these federal financial assistance in the calendar year 2020. And we are going to have Allison from our audit department, who is going to provide a separate webinar on these single audit requirements, because this is something that most proprietary nursing homes and most healthcare providers have not had to deal with. And it does apply now to for-profit organizations that these are federal grants that we are going over here. So these grants, if you've received or expended more than $750,000 in a reporting year, then you will be subject to the single audit requirements. And we'll have a webinar that discusses those obligations.
Claudia, just a couple quick points here. I mean, I think it's important to note that January 15th date for the portal opening, that was originally supposed to be October 1st. Right. Was when they had told us that the portal was open. And on the single audit requirement, it is $750,000, as Claudia noted, that you have utilized, spent in a calendar year. So it's not the provider's fiscal year. It's $750,000 per calendar year, and you'll be subject to the audit requirement.
And we should specify it's expended, not received.
Exactly.
Right. That is
right.
That's right as well. So excellent. All right. So then thanks, Claudia. And so going on now into some more details about the reporting. So what must be reported? So the guidance, the September 19th guidance gives us 4 basic categories of information that the HHS is going to be looking for from our providers. The first is a set of basic demographic information. So information, this is going to be information identifying the reporting entity, the tax identification number, the national provider identifier, if one exists, the fiscal year end date, and federal tax classification information. Then they're going to ask for expenses attributable to the coronavirus that have not been reimbursed by other sources. We're going to go into a little more detail on that here in just a second. And then they're going to ask for information to support the calculation of lost revenues attributable to the coronavirus. And so, this is a little bit of a change. In the past, for those of you who provided the attestations to the first and second general distribution funds, you were asked, the providers were asked to estimate their lost revenue. And we're instructed to use any reasonable method to estimate that lost revenue. The HHS is not asking for providers to provide an estimate of lost revenue now going forward in these reporting requirements. They're going to be asking for essentially hard data that they're going to use to plug into a series of formulas. And we're going to go over that here in just a second. And then the fourth element or fourth basic category is there's some additional non-financial data elements that basically these are statistical data elements that HHS is going to be aggregating for purposes of reporting the use of the CARES Act funds. So coronavirus related expenses. So these expenses may include those expenses incurred in the treatment of confirmed or suspected cases, preparing for possible or actual cases, maintaining healthcare delivery capacity, etc. So it's a broad bucket of expenses that can go into these coronavirus related expenses. Providers will be able to document both general administrative expenses and direct healthcare expenses. The expenses are to be recorded net of other reimbursement sources. So if you're in a state, for example, that's had a Medicaid supplemental payment through your state Medicaid program, we know a number of our clients are in states that have had supplemental Medicaid payments that are to go to coronavirus related expenses. Or if you've received direct payments from patients, you're going to have to, if you had a PPP loan and you've used that PPP loan, that payroll protection program loan that you expect to receive forgiveness on, if you receive some of that to cover some of those healthcare related payroll costs or additional expenses, you're going to have to net out these coronavirus related expenses against those other sources. The reporting of expenses will be for 2020, and then we expect possibly also January through June of 2021 if you have unused provider relief funds.
Andrew, if I could ask a clarifying question.
Sure.
Under that section then, under PPP, elements that were identified were like utilities, lease payments. Under this particular clarification from the feds, those, if they were assigned to PPP, would not be eligible to be assigned or taken into effect here. Is that correct?
That's exactly right. In general, we think that that's not going to be a huge burden. Those other costs, most providers are using the majority, if not all, of their PPP funds to cover payroll, and so we think payroll is going to be the biggest single issue. But Al, that's a great point. To the extent that you used your PPP to cover utilities, rent, or interest payments, and to the extent that you are including those in coronavirus as a coronavirus specific expense or an expense incurred responding to coronavirus, you're going to have to detail that out. You're going to have to account for it, and you're going to have to back it out. And we're going to walk through a little demonstration of how we think this calculation may work here in just a few minutes. Thanks. Great question, though. So expense reporting thresholds. As Claudia noted, you've got a couple thresholds here. You've got providers who received $10,000 or less, you've got providers who received more than $10,000 up to $499,999. And then you've got providers who received over $500,000. If you fall in that middle category, more than 10,000, 500,000, you're going to be able to aggregate your expenses into two big categories. So you're going to be able to just report G&A expenses and healthcare expenses. You're not going to be required to break those out. But if you received $500,000 or more in provider relief funds, you're going to have to provide additional detail within those two basic categories. And so that additional detail is going to be things like under general administrative expense, mortgage or rent payments. These can include, monthly payments for mortgage or rent. Al, that goes to just what you're talking about. If you got a PPP loan, you use that loan. If you're using some of the mortgage payments you made to cover, to qualify that loan for forgiveness, you're going to have to account for those here. Insurance premiums, personnel, personnel costs are pretty broad. They can include both direct payroll and training, staffing, temporary payroll, contractor costs, fringe benefits associated with that payroll, lease payments, utilities or other operational costs, and then just a kind of a blanket other G&A costs. And then on the healthcare side, you've got things like supplies. PPE is obviously a big one. Hand sanitizer, patient screening supplies, those sorts of things. Equipment that you may have invested in. We have clients who've, for example, invested in new HVAC equipment, or maybe you acquired a ventilator. IT costs to expand our healthcare. And it could include increased bandwidth, new telehealth, equipment to support telehealth. So iPads, devices for FaceTime, that sort of thing. The lease or purchase of temporary facilities or modification to existing buildings, and then another catch-all bucket. So any other healthcare related expenses. Support for the lost revenue calculation. So that the bucket we just talked about was the reporting of coronavirus related expenses. Then there's going to be another bucket that is going to be, you're going to be providing support for the lost revenue calculation. So Claudia's touched on this. A big change here, the thing that's kind of, I think, caught a lot of people's attention, is that lost revenues are now being defined as the negative change in year-over-year net operating income from patient care related sources. So a couple things to dissect there. First of all, we're being locked into a year-over-year comparison. Before, in previous recording elements, the HHS has basically said the providers could use any reasonable methodology for reporting lost revenue, and that could include, a budget to actual type comparison, could include a year-over-year comparison. We're being locked into a direct year-over-year comparison. And it is operating income from all patient care related sources. And so that's key as well. And I think we've gotten a few questions on that in the chat. Providers will have to report both revenue from patient care and total expenses. So that's another thing. You're reporting all revenue and all expenses, not just COVID related expenses, but all revenue and all expenses. You're going to have to report these items by quarter. And then you're also going to have to provide detail on any COVID related assistance you've received from other sources. So we're going to go back to if you've applied for a PPP loan that you expect forgiveness for, if you've received Medicaid supplemental payments. They mentioned things like business interruption insurance payments, FEMA grant money, any other sources you're going to have to detail out and provide to HHS. Claudia or Al, any comments on that before we go to the next slide?
I don't know if it's specific here. One of the questions in the chat is an employee retention tax credit considered other reimbursement sources.
If it is a tax credit, if it is a tax credit related to the coronavirus that is offsetting, that was made to offset coronavirus-related costs, then I think it probably would be.
I think that obviously this would have to be researched for your individual case. I also think if it's a standard local or state level employee retention tax credit that wasn't passed or wasn't set up specifically for coronavirus, I think an argument can be made not to include it in this.
Yeah, and we'll just point out, we're going to say this again and again, and I know we may sound like a broken record, but there is going to have to be a ton of clarification on the devil is going to be in the details with a lot of these programs, what gets included, what must be included. Claudia's already mentioned that we were expecting the first round of frequently asked questions. Actually, we were expecting them over this past weekend, and they have yet to be published. So, we're working in a world where, HHS is fairly liberal and providing, giving us deadlines for information to be provided, and then they're pretty routinely not providing it on time either. So, so reporting patient care revenue. So let's break that down. We've got to support this lost revenue. You've got three buckets. You've got patient care revenue, you've got other sources, and then you've got the expense side. So we'll try to keep moving through this pretty quickly here. Reporting patient care revenue. It's all charges for healthcare services, and supports, whether they're provided in a medical setting, at home, or in the community. The revenues are going to be reported as net charges, i.e. net of bad debts. You're going to be required to break out those payments by payer mix. So the specific categories that they've given us are Med A and B, Medicare Part C, Medicaid, commercial insurance, self-pay, and other. And once again, you're going to have to so you're going to have to take your revenue, break it out by quarter, by payer source in the reporting. Reporting on other assistance. So we've touched on this a little bit already. The providers will be required to report coronavirus-related assistance from all other sources. So this is going to include your Treasury, SBA, and CARES Act Paycheck Protection Program loans. Now, the interesting thing here is many of you are not going to have forgiveness. You may not have final forgiveness decisions on your PPP loans before you have to apply, before you have to meet your first reporting deadline, and that raises a lot of questions. If you should you do that as an offsetting source if you don't have a final forgiveness decision yet? Because otherwise, it's a loan. It's not a grant. It's only a grant once it's forgiven. Up until it's forgiven, it's actually a loan from the SBA. And so, I'm expecting we're going to need see some additional guidance on that. FEMA grants, CARES Act coronavirus-related testing reimbursements, any other local, state, or tribal assistance programs. So we believe this would include the Medicaid supplemental payments for providers who are in states where there are supplemental payments. Business insurance payments, so these would be claims under a business income loss, a BIL policy. As a practical matter, I have yet to see anybody actually have a successful coronavirus-related BIL policy claim, but still, I guess there is the potential, or any other assistance out there. Claudia or Al, any comments on those items?
No, other than the overriding theme is it's coronavirus related.
Yes, on the other sources, that is absolutely right. So then moving on to reporting total expenses. So this is the third bucket of information. Providers are going to be required to report total calendar year expenses for 2019 and 2020. So, once again, this is a change. A lot of the reporting we've looked at has gone back and started, say, in mid-February or early March. They are asking you to provide both revenue and expenses for the entire year of 2019 by quarter and the entire year of 2020. You're going to report those expenses in two basic buckets, G&A and healthcare related expenses, and you're going to include everything. So you're not going to carve out, for purposes of this reporting, coronavirus related expenses. You're not going to carve out expenses that have been reimbursed elsewhere. You're including all expenses in this section of the reporting requirements. All right, so lots of information, and I know I'm moving quick because we're on a timeline, but we've got about 10 minutes left, and wanted to take a second. We thought it would be helpful to walk you guys through an example of how we think this is going to work. Once again, there's going to be a lot of guidance out on this. There's going to be a lot of details. So this is just kind of a hypothetical. It's in line with other hypotheticals that we've seen out there in ACA presentations and elsewhere. So we think this is how it's going to work, but the devil's going to be in the details. But let's take a little hypothetical here. So we've got Shady Oaks Retirement Village. It's a 100-bed SNF, approximately 90% Medicaid, 10% Medicare or other payers. In 2019, occupancy was running about 85%. In 2020, because of the coronavirus, the occupancy has fallen off to about 70%. They received $590,000 in PRF payments, so provider relief fund payments. They took out a PPP loan of $625,000, part of which was used to pay $125,000 in COVID-related hazard pay, and another $50,000 of which was used to support some supplemental hiring or supplemental staffing to address coronavirus-related issues. The balance of the PPP loan then would have gone to just cover ordinary payroll. We're going to assume the facility received $150,000 in supplemental payments from Medicaid, and the facility was able to identify an additional $200,000 in coronavirus-related expenses. So additional PPE, maybe some HVAC upgrades, that sort of thing. So let's take a quick look and see how this might play out for Shady Oaks. So the first step is the reporting on the coronavirus related expenses, and then the calculation that we think HHS may do from that. So you've got your buckets of coronavirus related expenses, $125,000 in hazard pay, $50,000 in supplemental staffing costs, and other identified expenses of $200,000. Note that I've grouped all these, but because Shady Oaks received $590,000 in PRF funds, you're going to have to report those in those detailed subcategories. Then we have to, so that's a total of $375,000. We're going to have to then offset those to the extent that they have been paid from other sources. So to the extent that we use the COVID hazard pay and the supplemental staffing costs to support our PPP loan forgiveness application, we've got to offset those. Those have been reimbursed by the Payroll Protection Program loan. And then to the extent that we got the state Medicaid supplemental payment for this provider that was there to also for coronavirus related expenses, we're going to have to offset that. So the total funding from other sources against these coronavirus specific expenses is $325,000. That means a net of $50,000 in coronavirus related expenses for Shady Oaks. So that's the first step in the calculation, we think. And so then let's go on to the lost revenue calculation. So the lost revenue or lost net income calculation, as it's currently being defined, now we've got our 2 years side by side. So in 2019, Shady Oaks had $6.8 million in net patient care revenues. They had $3.4 million in healthcare expenses, $2.6 million in G&A expense, or a total expense of $6 million, and a net operating income of $800,000. In 2020, revenue's down to $5.6 million because of the decline in census, so about $1.2 million revenue loss. But then they're going to receive $625,000 in PPP loan forgiveness income. They're going to have then that $150,000 Medicaid supplemental payment. So total revenue is going to be $6.375 million, exclusive of PRF funds. Healthcare expenses down a little bit. G&A expense stayed about the same. We've got these additional COVID-related expenses of $125,000, $50,000, and $200,000. So total expense is a little over $6 million in 2020, $6,035,000, and that leaves us with a net operating income of $340,000. So in this example, and I know that's a lot of information, and that's why we're going to give you all the slides to look at, but in this example, their net income, the negative change is $460,000 year over year. 2019, they had positive net operating income of $800,000. In 2020, it's down to $340,000. That's so how do we take step one and step two and determine how much, how use of their funds? Before I leave this slide, I want to point out, keep in mind that this PPP loan treatment is going to be different than you may treat it on your tax return. For tax purposes, PPP loan forgiveness is not going to be considered income, but for purposes of reporting, that forgiveness is going to be treated as a grant, and you're going to have to report it to HHS. And the expenses that you use to support your PPP loan on your taxes, you're not going to be allowed to deduct those as an ordinary expense. But once again, for purposes of reporting, we think they're going to be included here. We expect this is something we're probably going to get some frequently asked questions about and see some additional guidance on. Claudia, or Al, anything you want to add there? All right.
No, that's
Trying to keep us moving. So then how does our hypothetical work out? So step one, you've got your net coronavirus related expenses of $50,000. Step two, you take your negative change in operating revenue of $460,000. You have to net it against the results from step one. So you have to back out the $50,000. So you get the $410,000, but then you add the two back together again, and we're back to the $460,000. And so if you think about that, what's happening here is HHS is saying, we're going to make providers whole vis-a-vis 2019. In other words, by adding that, by allowing up to the $460,000, they're essentially going to get this provider back up to the $800,000 in net income that they earned in 2019. But note here that Shady Oaks got $590,000 in PRF funds, which means that there's a likely recoupment here, we think, of $130,000. And so some major takeaways then. The change in definition of lost income is going to really impact how a lot of providers are looking at these PRF funds. Shady Oaks, in our example, had a $1.2 million loss of revenue, healthcare related revenue, but we think maybe they can only support $460,000 in PRF fund usage. The year-over-year comparison eliminates any trends, any changes in operational issues from related to PDPM. I know something Claudia has spoken a lot on, that PDPM implementation on the Medicare side. A lot of providers were experiencing a gain or were able to significantly revise operations to maximize reimbursement under PDPM. The simple fact is we're now getting locked into a year-over-year comparison, and there's really no accounting for those kind of operational changes. The PRF funds are going to be used last, it appears, meaning you only get to start utilizing your PRF funds after you've applied all other funding sources. In this example, we think Shady Oaks is likely going to be subject to a $130,000 repayment, but still, at the end of the day, the result is to essentially get the provider back to where they were in 2019. So if you had a positive net income in 2019, you're going to be allowed to use funds to get you back up to the same level. If you had a loss in 2019, they're going to allow you to use the provider relief funds to get you to zero, but not earn a profit if you didn't earn a profit last year. Lots of information there. I see we get lots of questions in the chat, but we're almost to the end of our presentation. Keep in mind, this is an area where we expect to see a lot of additional future guidance. Al, Claudia, to keep us moving, Al, you want to cover the additional data elements real quick?
Very quickly, this was mentioned earlier by Andrew in a slide, and it's published in the post-payment notice of reporting requirements that was dated September 19, 2020. And basically, in addition to the demographic, the expenses attributable to coronavirus not reimbursed by other sources, and lost revenues attributable to coronavirus, they've got additional data elements that they're going to want reported per quarter once the portal's open. We'll be basically looking at personnel metrics, such as your total personnel by labor category, full, part-time, contract, total rehires, total new hires, total potential separation by labor categories. Patient metrics such as your total number of patients, total number of patient visits admitted, and the total number of resident patients. And then facility metrics such as the total available staff beds, or your medical surgical, your critical care, your other beds. Additionally, addressed, if we could go to the next slide, we're addressing the change in ownership. And this, from the, they had addressed it earlier in July 8th, frequently asked question where they stated that previous owners were not permitted to transfer funds to the new owner, and they were instructed to return the funds to HHS. And at that time, HHS was not going to return payments to the new owner. And they specified that they would be able to apply for them at some later point. Well, this is the later point. Entities now may apply under the phase 3 general distribution that Claudia was discussing, and the open application period is from October 5th through November 6th. I don't know, Andrew, do we want to go through the questions that we've got set up here?
I think at this stage, so we did have some questions that we had received in advance, but we are hard up against our 1 p.m. deadline. So and we want to try to keep our presentation on track. We want to be respectful of everybody's time. We appreciate everybody joining us today. We have a lot of questions in the chat. We will try to reach out to everyone on the chat directly. So we appreciate you giving us those questions. We'll try to reach out to everybody over the next couple of days. Everyone will receive a copy, and we'll also provide answers to the common provider questions that we did stick in the slides. But I think we probably need to go ahead and wrap it up. So thank you everyone for joining us. And Nancy, I'll turn it over to you to close us out.
Yes, that was a great job, guys. Thank you everyone for joining us today. As we'll follow up with everyone who had any questions in the chat. And if you have any other questions or need additional guidance, please don't hesitate to reach out to a member of our team. Also mentioned, we'll be hosting another webinar on single audit requirements with Allison Jones from our audit department. Since we've been getting a lot of questions about that and it's a big topic, we'll have a whole webinar dedicated for that. So keep an eye out for that information. And thank you again for joining us today, and to our healthcare team for continuing to share their knowledge and expertise with everyone. And we hope to see you guys again soon.
Excellent.